slang words blues or kickers, what about OC or Oxy? Do you know what these slang words mean or what they're referring to? According to the article, Oxycontin Street Names by Michael's House, copyright 2017, blues, kickers, OC, and Oxy are all street names for the highly addictive prescription drug hydrocodone. Now I'm sure you're wondering why you need to know this information. Our world is currently experiencing an oxycodone epidemic. The drug's level of abuse has risen so high that millions have fallen victims to its very addictive nature. Those abusers include teens that are making bad decisions, middle-aged women and men that are looking for stress relievers, and lastly, our elderly that went to have surgery and was prescribed a hydrocodone, and now they can't stop taking the pills. So today, to help put a stop to this epidemic, I want to educate you on what exactly oxycodone is, how to spot an abuser of this drug, and what steps we can take to help an abuser recover from their addiction. Let's start with what is oxycodone. According to the articles OxyContin Fast Facts from the National Drug Intelligence and Opioids from the National Institute on Drug Abuse, copyright 2017, oxycodone is an opioid prescription pain medication. Opioids are a class of drugs that include illegal drugs like heroin and other prescription drugs such as hydrocodone, codeine, and morphine. These drugs are chemically related and interact with the opioid receptors on nerve cells on the brain and body. Now, oxycodone can go by many different brand names. Some that are common are OxyContin or Roxadone. There's also multi-ingredient prescription drugs such as Percocet. Oxycodone or OxyContin is available in 10, 20, 40, or 80, or 160 milligram tablets. The tablets vary in size and colors according to the dosage. The pills are implanted with OC on one side and the milligrams on the other. Oxycodone or OxyContin is a Schedule II substance under the Controlled Substance Act. Schedule II drugs, which include cocaine and methamphetamine, have a high potential for abuse. Abuse of these drugs may lead to severe psychological or physical dependence and most common death. For example, take Summer's story from Addicted, an Oxycontin Tragedy by Michael Kahn, written December 12, 2001. Summer was just 16 when she began to hang out with a much older guy named Rufus. One night, Summer went to a party and brought along her 13-year-old sister, Sean. Rufus was at the party and offered the girls pills, which he claimed were muscle relaxers. Summer took the pills and she passed out. When she came to, she was very woozy and Sean was frantic. He kept saying, and Rufus was frantic. He kept saying Sean was dead. Summer found Sean's lifeless body on a bed with no heartbeat. Summer called 911 and Sean was taken by ambulance to a nearby hospital. Unfortunately, Sean did not make it. She died of an overdose. According to the toxicology report, it is estimated she took 6 80 milligram pills. Summer's story is very sad. A young girl isn't alive today due to abuse of drugs. Sean wasn't suffering from addiction. She was an outside victim of drug abuse. She was pressured by Rufus, who was the real addict. Now I'm sure you're asking yourself, what are signs to look for an abuser like Rufus? According to the article Oxycodone Addiction Signs Symptoms of Abuse from the American Addiction Center, copyright 2017, some key factors to look for if you believe someone is falling a victim to drug addiction are excessive fatigue, inability to perform their normal routine, lifestyle, personality changes, appearance changes, and being secretive. Since oxycodone can be snorted, injected, or taken by pill, you should also look to see if the person has irritated nostrils, puncture sites on the arms, an excessive amount of pill bottles laying around. Lastly, people with oxycodone abuse also start lying, cheating, and pulling away from family. And most importantly, they're in denial. Unfortunately, the abuser's judgment is so clouded that they don't see the big issue. And the big issue is they're abusing drugs and death is knocking at the door. Recognizing that someone is addicted is only the first step in helping that person. What else? What can we do to help that person recover and help prevent others from getting addicted? According to What You Should Know About Quitting Oxycodone from Recovery.org, created on January 12, 2016, Treatment programs are available to assist with the physical and emotional difficulties of overcoming oxycodone addiction. Inpatient, outpatient, group counseling, and individual therapy are all options and steps to becoming addiction-free. Inpatient offers 24/7 support. Many people transition from inpatient to outpatient once they have been addiction-free for a while. Outpatient rehab allows you to have treatment while living at home or while you work or go to school. Group counseling is led by a counselor treatment professional. Clients help one another by providing support and advice from similar experiences. Lastly, individual therapy is a one-on-one treatment provided by an abuse counselor. Oxycodone rehab programs are very much available these days, and success rates have already reached up to the 79%. Unfortunately, treatment is a very bumpy road. Withdrawal symptoms are very intense and are the #1 reason why people fail at becoming addiction-free. According to the article, Oxycodone withdrawal symptoms, links, and detox centers, copyright 2017. Common symptoms include irritability, agitation, depression, insomnia, thoughts of suicide, anxiety, inability to concentrate, body aches, and many, many more. Oxycodone addiction is an easy thing for people to fall into, especially if the drug was prescribed to you. You think it's completely safe. While the drug was a breakthrough in discovery and pain management, it has now become an issue of abuse. With the information I gave today regarding oxycodone, which included what it is, how to spot an abuser, and how to help an abuser recover from the addiction, I hope more people are educated on the issue of oxycodone abuse. How are you going to help the millions of people suffering from oxycodone abuse? Well, we all need to step up and educate one another before our family, friends, or even coworkers fall a victim to this abuse. Thank you. Now I would like to open it up if anyone has any questions, or I would have a few questions for my audience as well. Yes? What's your question?
Have you been personally affected by someone that has been addicted to
oxycodone or hydrocodone? I have not personally been affected, but I've had friends that I've seen their family members go through it. They've had surgeries and then they become addicted to the pills, and it's very hard for the entire family when you have a person addicted. Thank you. Anyone else have a question? Yes.
Would you hold an intervention if one of your family members was an addict to hydrocodone or
oxycodone? Absolutely. They say that's a very effective way of opening up the eyes of the abuser. It kind of puts them at the center of attention, and hopefully it pulls them out of denial. It shows them that not only are you personally suffering, but your family members around you are suffering from it as well. Is there any other questions? If not, I have a few for you guys. What was the most interesting part of my speech today? Does anyone have any input? Yes, what did you like?
What kind of shape do you eat?
Oh, what kind of shapes do the pills come in? That's a great question. They vary. They come in many different sizes and many different colors. If they have a different milligram, they'll be a different color and size. So, good question. Thank you. I have a question. Has anyone ever been prescribed oxycodone? You have? Good. Did you have any adverse effects from oxycodone?
No, I did not.
No, you did not. Well, you were a lucky one then. And my last question, before my speech, did anyone realize there was such an issue with oxycodone? Or was this all new information to everyone?
Pretty new information.
Pretty new information?
Yeah.
Pretty new? Good. All right. Well, if there's no other questions, I'd like to thank you for listening to my speech, and hopefully you're more educated on the topic of oxycodone abuse.